Greetings, this is Rob Allen I. Madrid of BSN 3B, and I will be providing tracheostomy care. The patient exhibits a tracheostomy tube and site free from drainage, secretion, and skin irritations or breakdown. Bring equipments to the table. Perform hand hygiene and put on PPE if indicated. Identify the patient. Close the door. Determine the need for tracheostomy care. Adjust the bed to a comfortable working position, usually elbow height of the caregiver. Lower the side rail closest to you. If the patient is conscious, place him or her in a semi-fowler's position. If the patient is unconscious, place him or her in the lateral position facing you. Then move the overbed table close to your work area and raise to waist height. Check for lung sounds. Place the towel below the trachea site, covering the neck and chest of the client. Put on face shield or goggles and mask. Suction tracheostomy if necessary. If tracheostomy has been just suctioned, remove solid site dressing and discard before removal of gloves and use to perform suctioning. Prepare the basins and cleaning solutions. Mix sterile water or plain NSS and hydrogen peroxide in one basin and another PNSS in another basin that will fill at least ½ inch. Perform gloving. Stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand, then grasp the locking mechanism of the inner cannula with your dominant hand, press the tabs and release the lock. Gently remove the inner cannula and place in first basin with the plain NSS with hydrogen peroxide. Gently stride the tracheopad or dressing downward and discard. Check for some exudates or drainage, skin breakdown, irritation, or inflammation. Clean the inner cannula of the trachea tube using the prepared PNSS plus hydrogen peroxide and use brush to remove solidified or sticky mucus. Rinse using the second basin with PNSS only. Dry the inner cannula using sterile gauze pad. Gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Deep cotton-tipped applicator or gauze sponge in cup or basin with sterile saline and clean stoma under faceplate. Use each applicator or sponge only once, moving from stoma side outward. Pat skin gently with dry 4x4 gauze sponge. Slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch dressing under the faceplate. Check the fit of the tracheostomy collar. Assist the patient to a comfortable position. Remove gloves and additional PPEs if used. Perform hand hygiene. Document the procedure. Reassess the patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds.